Patients, they check in for registration here. A nurse eyeballs them, make sure they're not dying. If not, they're moved to one of 2 triage rooms for vitals and a quick chair exam where you can run your labs and your x-rays.
And then they come back to...
Waiting room till bed opens up.
For how long?
8 hours if they're lucky. A lot of times 12.
Is it always this busy?
No. It gets a lot busier.
This is such a realistic depiction of what happens. There are definitely days when I used to walk into the emergency room and have 12 stretchers lined up inside the emergency department with behavioral health patients waiting for placement somewhere. And behind the scenes, there's a social worker making phone calls, sending faxes, waiting for phone calls back. This underlying system that causes a lot of these delays has significant downstream effects and impacts for all of the patients that come into the emergency department and the resource availability in the emergency departments. There's significant solutions and opportunities when we look at innovation and systems that are on the back end of why these delays are happening, especially for this emergency psychiatric patient population, to quickly move those patients into a receiving psychiatric bed. A lot of times there is the notion that these beds are all full. However, as we've launched XFERALL across the nation to automate this process, we have found that typically there are beds, been able to reduce the amount of time to find a bed down to 37 minutes, drastically moving these patients out, making room for other patients to come into the ED, improving throughput. It's great to see this depicted on the Pitt to show what is actually happening and what sort of pressures hospitals are facing and what types of solutions they're needing in order to improve the care and also create efficiency for their very precious clinical resources.